Hello, my name is Susan Gove with Asha School of Massage, and I'm here today shooting a video with John Howard, who's going to be teaching us a little bit about active isolated stretching. He does a continuing education course at Asha, and I thought it would be good for him to just demonstrate and us to get a feel for what this very extensive body work is like. John, tell us a little bit about yourself and about active isolated stretching and what its benefits.
Yes, Susan, I'm a licensed massage therapist in the state of Georgia and Florida. Today we'll be doing a technique that Aaron Mattis developed 41 years ago. Aaron developed active isolated stretching and the strengthening part, and he has a rehab clinic in Sarasota, and he goes around the world, teaches these seminars, and I'm also a teacher's assistant for Aaron.
That is fantastic. You mentioned a little bit of some of the conditions that it helps with. Tell us a little bit about that.
AIS is excellent for acute and chronic pain conditions, sports injuries, increases athletic performance. It's also excellent for spinal cord injuries, muscle diseases, neurological disorders, joint replacements.
That is amazing. So people who have what with, I know you mentioned fused spine, like fused upper back, this would help with them?
There's no contraindication. Matter of fact, you want to do that because what normally happens with people with fusions is above the fusion, they'll have to get fused because the muscles haven't been worked or stretched or strengthened.
Okay, what exercises are we going to learn today?
Well, today we're going to do part of the shoulders and neck routine for posture weakness. So
Okay.
we're just going to demonstrate 4 stretches today. But
So
the
not
result
the
is
strengthening, just the stretching.
not the strengthening. For the shoulders and neck, we probably have over 25 or 30 different strengthening exercises we'll do and over 60 stretches.
Will they learn all that in class?
Absolutely.
Okay, great. We have Gail here, who is actually a client of John's, who's been kind enough to have us demonstrate on her.
I've been working on Gail. She does a lot of data entry for about a couple months. When I first met Gail, her shoulders were going quite a bit forward head posture with the shoulder, with the ears about 3 inches in front of her shoulders, and the shoulders were rounded and quite a bit of a kyphotic state. And so much it was starting to crystallize and form in a kyphotic state. So we kind of broke up the crystallization, helped with her thoracic extension, which we're going to be demonstrating right now, Gil. We're going to go ahead and work from the center of gravity up. The center of gravity is at thoracic number 9 and 10. So that's where we're going to place the belt, at thoracic number 9 and 10. And we're going to work from there above. And so we go 11, 10, about right here is where we're going to put the belt. And I want to place the belt there. I don't want the lumbar to go in extension, so I'm going to place the belt also over the feet right here so it doesn't raise when we do this strengthening part of our upper thoracic. So we're going to strengthen the upper, stretch the anterior thoracic, upper abdominals, serratus, obliques. She's going to roll her shoulder blades together and lift her chest up and exhale. Inhale, exhale. Normally I do about 8 repetitions, but today I'm just going to demonstrate this. For this video, we'll do 1 more and exhale and look up. There you go.
How important is the exhale when she's contracting up like that?
Well, you want to exhale on the concentric to bring blood and oxygen to the tissue. These stretches are just for a second and a half. You don't want to hold the stretch. You get a myotatic stretch reflex after a second and a half.
What's a myotatic stretch reflex?
It's a stretch reflex. Another muscle will contract after 2 seconds. So we want to increase the range of motion with short movements to increase the circulation. So normally I'll do 2 sets here at number 9, 2 at number 8, and 2 at number 7. For now, that's all we're going to do. We're going to work on getting some of this chest stretched out next. Because if you're on the computer all hunched over, we've got to get that stretched. So Gil, slide up a little bit. We're going to get the pectoralis minor, and we're going to get the pec major where it attaches at the clavicle. We're going to use a 45-degree angle pressure. Keep your chest down, Gil, for me. So we're going to stretch that out. You're going to inhale and exhale, and I'm pulling out a 45-degree angle this way.
Is Gail...
She's doing the work.
Okay.
See, she's strengthening those muscles in the back of the shoulders. I'm applying a little stretch at the end, increase the range of motion a degree at a time. 1 more time, Gil. and exhale. Keep the chest down. And now we're going to grab the table legs, and I'm going to place my hand at thoracic number 1 for the next stretch.
Okay, I'm just going to move the camera so that they can see the angle or where you're actually holding her neck.
Gail's going to strengthen her cervical extensors, semispinalis, cervicus, and capitis, and semispinalis, and the cervical trap, rector spinae, and she's going to look up and back down. We're stretching the anterior prevertebral muscles and the sternocleidomastoid. Inhale down, exhale up. She's using her neck only. So now I'm going to rotate 45 to the left. She's going to take her left ear to outside her left scapula. Again, we're going to strengthen the cervical extensors on this side. We're stretching the anterior scalene, sternocleidomastoid, and the prevertebral muscles on that side. I'm just applying gentle pressure at the end, and she's exhaling. The angle is very important. If I was to go at a different angle, like this, in this direction, I'd be putting undue stress on the vertebrae. This is excellent work for herniations, fusions. There's no contraindication with this. And exhale.
But you do want to be really precise.
You got to be very precise in where you're going. This work is very specific. We use localized, precise movements to stretch specific muscles. And exhale. We got a pop there. Gail, you okay?
Fine.
Good. It's good to have a flexible neck and a strong neck. We want the muscles to be lengthened and strengthened to support the head. Okay, Gail, go ahead and come on up. If your head doesn't move or articulate, you're not getting much oxygen or blood to the brain, so it's good to have a flexible neck. Notice Gail's posture's better. Her ears are over her shoulders. She's upright more. Thank you, Gail. I appreciate it.
Are you going to do some more of these instructional videos for people?
Yes, you can visit my website at www.touchofhealthcenter.com. In the future, I'll have more videos, but right now we're going to have this one posted up, and I can also be reached at 770-815-3365, or to register for the class, go to ashamassage.com.
Thank you so much, John.
Thank you.